Yes, good evening to everyone who's joined us in now. Yeah, we'll just wait for a couple of minutes. We have some students joining in. Oh. Yeah, good evening, Dr. C. Marya, sir. Can you hear me?
Yes, I can. I can hear you. Am I audible?
Yes, sir.
Great.
All right, let me just, because the people, students and everyone. Okay, great. Good evening, Vamshi, sir. Hi, sir. Okay, lovely. So we just have people in the waiting room, so I'm just admitting all of them. Meanwhile, good evening to all other faculty members, postgraduates, undergraduates, and everyone who's joined us today. Welcome to the Teachers' Day special of PhD 101, which is Public Health Dentistry 101. Now, I think we've come across a lot of scientific presentations and everything, and since given the situation, we have been compelled to take the online platform. But nevertheless, I think every opportunity to get conversations going is extremely pertinent. So the whole, just a brief introduction about what exactly is PhD 101 and what do we do to all the people who are new to this platform. Public Health Dentistry 101 is, okay, we have, just a minute, we have Basuraj sir with us, all right. Okay, hello, good evening Basuraj sir. Yeah. Okay. So Public Health Dentistry 101 is an online educative platform dedicated to the subject of public health dentistry. Now here we basically collaborate and bring along public health dentistry faculty and postgraduates and students from across the country. It's actually really heartwarming for me to share with you all that we've been doing this for the last couple of months, and we've gotten very good response. In fact, for today's presentation, we already reached close to about 400 entries. So we'll be having all of them join us. Yeah, so coming back to the whole specialty of public health dentistry, the specialty which deals with the population oral health, and I think the esteemed speakers today will be highlighting on all of those pertinent topics to you all. So we've chosen a Teachers' Day special where we have stalwarts from our specialty, like starting from Dr. Charu Mohan Marya sir, CM Marya sir. Followed by that, we have a session by Dr. Chandrasekhar Jankiram sir. And then we have Dr. Vamshi Reddy sir, who will be addressing. So they will be touching upon the pertinent aspects of the specialty as to what are the challenges, the opportunities, what are the competencies required, and their reflections and experiences in the field of PhD. So with this, I think I'd like to welcome everyone who's taken out time on a Saturday evening to join us here on the platform. So I request a few instructions before we get this going. Now we have these sessions lined up from starting from 6 o'clock now, and it will be running up till 8 o'clock. So we have the sessions and we have a little bit of fillers in between. I would hold on to the surprise because we have something really fun and interesting coming up between the sessions. And then we will take it forward. So I request all of you all to participate actively and to make full benefit of this, and to finally bring the conversation about what is dental public health and how it benefits people across. All right. Yeah, good evening, Marya sir, our first speaker for today. Yes, sir. So let me just give a very small brief introduction about Marya sir. Now, Dr. CM Marya sir, who's our first guest speaker for today, is the Principal and Dean for Academics, Professor and Head, Department of Public Health Dentistry, and sir is heading the department as well as the Dean for the Sudha Rastogi College of Dental Sciences and Research, Faridabad, Haryana. Sir has been a very, very celebrated, eminent personality in our field. I'm sure everybody would have come across Sir's textbook, the practical manual, and so much of more contributions to our field. So I wouldn't want to take away too much of your time, and I request Marya sir to take over the proceedings from here.
Dr. Bamsi, if to allow me to share my screen.
Yeah. Okay. Yes, sir. You can share your screen.
So a very good evening to one and all, and wish you all a very happy Teachers' Day. There are some who are going to be teachers in future, and there are so many teachers which are already online and attending this lecture today. Thank you so much, Dr. Denzy, for giving a huge introduction about a small man. Thank you so much for that. The topic given to me today was challenges and opportunities in public health dentistry. And three of my colleagues are going to speak on related topics, which are of course different, but they are related to each other. So I'll start with my presentation. As Dr. Denzy has already told you, I'm Principal and Dean Academics for Sudha Rastogi College of Dental Sciences and Research, Faridabad. Now, it's an honor to share the platform today with Dr. Vamsi, Dr. Chandrasekhar, and Dr. Manjunath will be speaking on 12th, I have been told. And all of us are here because of these two people who love passionately the subject, the field of public health dentistry. And I would really like to thank Dr. Denzy to make this happen. So the first step towards thinking outside the box, people, is getting out of the box. So if you want to think differently, you cannot be sitting at one place. You have to get out of the box, and then only you can start thinking differently. So dental public health dentistry stands as the dental conscience of the nation. Dental public health is a unique discipline that is formed by marriage of the broad field of dentistry and public health, with a strong emphasis on the prevention of oral diseases and ensuring provisions of adequate preventive and treatment services among vulnerable groups. Now, why I said marriage? Because you cannot separate dental public health. When we talk of dental public health, you cannot separate dentistry from public health. Though, unfortunately, so far it has been, but this has to end soon. So now, what is the cause of concern? As a public health dentist, the cause of concerns are inverse care law. That means oral health services tend to vary inversely with its need in the population served. To make it simple, in other words, those who most need medical care are least likely to receive it. Second is oral health disparities. Oral health care disparities reflect unequal opportunities to be healthy, making disadvantaged group even more disadvantaged with respect to their oral health. Reducing oral health care disparities means giving disadvantaged social group equal opportunities to be healthy, that is low income, minority, rural and other underserved population. So if we want the health to improve, we need to cater to these people's need. Third is consequence of oral disease. All oral disease have a negative impact on quality of life. The impact may vary, but they do definitely have, from children to the elderly, they do have an impact on their quality of life. So dental public health as a savior. Why I am saying that is, dental public health is distinguished from other disciplines of dentistry in its pursuit to serve the community as a patient rather than the individual. Aims to improve oral health at population level with a strong emphasis on the prevention of oral diseases and the provision of adequate preventive and treatment services to the entire population. However, its achievements in India are being probably underestimated. The public dental health professional, with his or her understanding of dental problems and his or her competence in dealing with community health problems, can be a decisive influence in the development of health programs. So what are the essential public health services? These are the public health, but you would be surprised to see that they absolutely match with what dental public health services need to be. So if I talk of essential public health services, the first one is monitor health status to identify community health problems. Second is diagnose and investigate health problems and health hazards in community. Third is inform, educate, and empower people about health issues. Mobilize community partnership to identify and solve health problems. Develop policies and plans that support individual and community health efforts. Enforce laws and regulations that protect health and ensure safety. Link people to needed personal health services and assure the provision of health care when otherwise unavailable. Assure a competent public health and personal health care workforce. Evaluate effectiveness, accessibility, and quality of personal and population-based health services. Research and new insights and innovative solutions to health problems. So these are listed public health services, but if you see, each and every point does relate to dental public health also. Now, what is a dental public health model? The oral health care and education with an emphasis on utilization of dental hygiene science delivered to a target population. A common misconception about dental public health is that its primary objective is the delivery of dental care to low-income persons. So that is what is usually thought of public health dentistry, especially in our country. I mean, it's a common misbelief that it is basically public health dentistry is to cater to the low-income persons. Although that is important, the actual delivery of dental care is only one aspect of dental public health. That is not the only thing. It is part of the dental public health. The three major core functions of public health, as identified by the 1988 Institute of Medicine study, are assessment, policy development, and assurance. And the major activities of dental public health can be divided into these same categories. So it is not just serving the low-income people. It includes assessment, policy development, and assurance. More than that, but especially these three things are to be taken into consideration. Now, what is the problem? The problem is the dental public health model itself. Why I am saying that is, the scope of dental public health practice, it's felt that it is all about fluoride, seal, brush, and fill. Education, finance of dental care. So, because everybody believes that this is what is the dental public health model, so there is no demand for dental public health expertise. Everybody feels that, yes, anybody can do this because it is just fluoride, education, and finance. They think it's a commodity, undifferentiated service. And it is thought that everybody can do it. But my question to you is, can everybody do it? Are you trained for it? So what is the basic challenge? The most basic challenge I as Dean face is clinical versus non-clinical. It is a common misbelief in our country that dental public health is a non-clinical branch. Very unfortunate, but that's the fact. And I feel somewhere we as teachers have failed in our responsibility to propagate or to tell about the subject in a way we should have. Because most of the times it has seen that, especially in my college, when the interns pass out, I usually have a word with them and I ask them, okay, what now? They say, sir, we'll go for post-graduation. Okay, which branch? Sir, clinical branch. I say, what about public health dentistry? Oh, sir, it's a non-clinical branch. I ask them, who says so? Just because in curriculum of public health dentistry at the undergraduate level, it is usually very small procedures or usually the history taking and indices. But in many of the colleges where the postgraduate is running, Either the students don't have the access to the postgraduate department, or maybe there are at certain colleges, probably it is not taken up as a clinical branch. I really don't know. I fail to understand, but why this is happening, it's a point to ponder. So there's a change. We have to change or we have to die. Drill and fill is not the solution. We are not going to eliminate oral health disparities by focusing only on applying fluorides and sealants. The implications. We have to move from brush, seal, varnish and fill to integrate oral health promotion and dental care model, apply current theories in health planning, health promotion, positive behavioral change models and implementation. We have to move from fluoride sealant education to addressing the cause of inequality and inequalities in health and oral health, comprehensive dental oral care models, and we have to move to advanced oral health promotion. So we need to redefine dental public health. So dental public health is a scientifically based specialty of dentistry and public health that integrates knowledge and experience from dental, behavioral, public health, educational, and political sciences, with experiences from business, management, marketing, and advocacy. All these words, I have put it in a different font, in a different color. So can you imagine the amount of things which are included in public health dentistry and what generally it is perceived as? To promote health and oral health and provide primary, secondary, and tertiary dental care for individuals and populations. So, root cause of health disparities. The gross inequality that we see in the world, both within and between countries, is not inevitable, but definitely malleable and can be changed. Social factors are at the root of much of these inequalities. Health status should be the concern of policymakers in every sector, not solely those involved in healthcare. So it is not just involved with health. There are so many other. For example, I can tell you, the health sector. There is a probably a ministry which deals with cigarette. There's a ministry which deals with tobacco. There's a ministry which would be dealing with alcohol. Are we not concerned with those? Yes, they are definitely going to have an impact on health and oral health. So what are the attributes of oral healthcare system? These are the ideal oral healthcare system. Integrated with healthcare system, emphasis on health promotion and disease prevention, monitors population and oral health status and needs, evidence-based, should be effective, should be cost-effective, should be sustainable. When I say sustainable, it means that once probably the government starts something and then government stops the funding, so the individual should be able to sustain themselves. Equitable, should be universal, comprehensive, ethical, continuous quality assessment and assurance, culturally competent, empowers communities and individuals to create conditions conducive to health. So this is ideal oral healthcare system, and public health dentist ensures or tries to do all this. Now this is a very good picture I got from my friend Dr. Chandrasekhar's publication, Journal of Indian Association of Public Health Dentistry, 2016. The curriculum existent in United States of America shows that a specialist in dental public health has sufficient training to ensure understanding and the practical application of concepts involved in the planning, formulation, implementation, operation, and evaluation of dental public health programs, and also an understanding of the process through which health policies are developed and regulated. Now, if you see the diagram, this is what we are doing here. This is the current scenario of public health dentistry in India. So we are just doing probably assessment, and then what is the scope? Teaching and NGOs. But actually, dentistry or dentists in public health are supposed to be doing assessment, assurance, policy development, and then the scope, this huge list has been given by him. Epidemiologist, health managers, health specialists. So there's a lot more than what is currently being done in India, and probably Dr. Chandrasekhar would be talking more about it in his presentation, I suppose. There is a stark similarity in prevalence of dental diseases. Now, if you see, the prevalence of dental disease does not typically decrease over time in the same cohort. DMFT does not decrease usually. Caries prevalence does not decrease usually. Exception is fluoride does have some reversal effect. Now, periodontal disease prevalence may decrease depending on how it is measured. Pocket depth may decrease. Active periodontitis may be eliminated. Attachment loss may be regained, but a history of periodontal disease or bone loss doesn't disappear. Maybe with graft you are able to achieve some bone growth, but it just doesn't go away. Same is the case with oral cancer. Same is the case with dental trauma. So if we can't change the disease levels, let's prevent it. They are preventable. Definitely they are preventable. As a dental public health expert, what are you hoping to achieve in the field? The overarching goal of dental public health is to positively impact the oral health of local, national, and global populations, particularly the disadvantaged, underserved, and vulnerable through excellence and innovation in research, education, and service. We are particularly inspired to achieve this goal by addressing the challenges listed above through research, innovations, and education, and the translation of science to dental practice and the community. So it is not just dental public health as it's perceived. It is unappreciated aspect of dental public health. The versatility in these specialty is unique. You can be a clinician, academician, dental public health programmer, research work, and many more. So what were the conventional opportunities in public health dentistry? These were biostatistics and informatics, technical medical writer, community health program coordinator, public health educator, emergency response specialist, environmental health, epidemiology and research, global health careers, academics, social work in collaborations with NGOs. And what are the newer opportunities? In inclusion to what I have told you in the previous slides, epidemiological studies for the development of vaccines to prevent oral diseases, salivary proteomics in screening of oral cancers, epigenetics, oral health literacy, role of dentist in disaster management, problem-based learning, public health services at school level as well. So these were the opportunities a public health dentist can have in the due course of time. Now, overcoming the barriers faced in the utilization of dental services. Firstly, what are the barriers? I will not go into the details because you probably would have learned in your final year or internship. But basically, these relate to physical, social, mental, psychological, etc. And what is to be done? Identifying barriers and addressing them. Overcoming neglect-focused awareness programs. Affordable, accessible oral health coverage. Strengthening existing systems of oral health care. Transition from standalone programs to community integration. Competencies of a public health professional. Manage oral health programs, demonstrate ethical decision making, evaluate systems of care that impact oral health, design surveillance system to measure oral health status, communicate on oral and public health issues, lead collaborations on oral and public health issues, advocate for public health policy, legislation, and regulation to protect and promote the public's oral health and overall health, critically appraise evidence to address oral health issues for individuals and populations, conduct research to address oral and public health problems, integrate the social determinants of health into dental public health practice. What are the key challenges for population level prevention in oral health? Since the discovery and implementation of fluoride, we haven't had such a breakthrough in prevention at a population level. There is availability of several promising preventive measures, including pit and fissure sealants, SDF, but its uptake at dental practices is very low. Reason? The dental care delivery system in India is designed to incentivize dental professionals to provide treatment rather than focus on prevention. Prevention of oral disease requires change in lifestyle and behavior changes, which pose significant challenges at a population level. Changing demographics, that is increasing elderly population who are retaining more of their teeth. Globally, poor oral health amongst older people has been particularly evident in high levels of tooth loss, dental caries experience, and the prevalence rates of periodontal disease, xerostomia, oral precancers, and cancer. The negative impact of poor oral conditions on the quality of life of older adults is an important public health issue which must be addressed by the policymakers. Separation of oral cavity from the rest of the body. Health system alienates dental care from overall disease prevention, and this is a key challenge dental public health experts are trying to overcome. Training and capacity building. Future generation of dental professionals need appropriate training to equip them with necessary skill, knowledge and attitude required to promote oral health equity. Interdisciplinary working in the healthcare sector and engaging in partnership with communities is essential to enhance the quality of care and to reduce health inequalities for the population. Approaches in health service provision. Basically, there are three approaches: the upstream approach, the midstream approach, and the downstream approach. Now, this is a very interesting topic which I am trying to take up today. The upstream approach has a population or public health focus which prevents illness occurring in the first place. So the upstream approach will be don't let the disease happen. Midstream approach focuses on the lifestyle and behavior of an individual and includes health promotion and preventing using behaviorist approach, whereas the downstream approach is dealing one-on-one with an individual who is sick or injured using the biomedical approach to care. I'll try to simplify for you, especially the undergraduates. So what is upstream approach? The upstream or population health approach is to approach to services focuses on entire population by eradicating the source of the problem. So we are targeting at the source of the problem. Example of this approach include government policy that affects the whole population, public health measures to eradicate source of the problem such as communicable diseases, socio-environment factors which focus on how environmental issues including unemployment, poor infrastructure, income and stress affect the health of the population. Now the downstream approach refers to interventions addressing the problems after they are already there. That is, they are trying to mitigate them without looking so much at what is causing them. Upstream referred to addressing the social, economic, political, and environmental determinants that cause the problems and intervene early. So a downstream approach to tackle the problem of cancer in a particular community would be to increase screening and to improve treatment and access to the treatment of those affected. So the downstream approach is after the disease has taken place, you are trying to find out, doing the screening and providing treatment. Whereas the upstream approach would be to study what environment factors might be responsible for causing the cancers and fighting, say, the corporation releasing poison into the air or water supply. So we are trying to find out at the grassroots level why exactly the cancer is happening, not after it has happened, and then we are trying to find who is having it and how to treat it. So let me show you this slide. It's a very interesting slide. I need you to focus at these two particular areas of the slide. What do you see? Which option is better? The second one, that is this one here, which I am saying, pulling out the people out of the rivers as they come down and stopping them from drowning. The other option would be to go upstream and find out why people were falling in the river at the first place or who was pushing them in and dealing with that issue first. So this slide is showing a person is throwing the people into the river and a person down below is trying to help them or trying to save them. So either we can go with this approach, which is supposed to be a downstream approach, or we go further ahead and find out why they are into the river at the first place, because somebody is pushing them or they're falling into it. So if we are able to tackle the problem at this stage, there is lots we can save. I'll tell you in my future slides what I'm talking about. What are we going to save? So can we deal with this situation? Another important thing, you are not, I mean, this is a very familiar slides to all of you. A boxing match, whereas a person is shown to have his tooth knocked out with a punch, right? Or we can avoid that by wearing a mouth guard, right? So boxing is still going to go. The game is not supposed to be ended, but you can prevent dental trauma by just wearing a mouth guard. Another important example is, this is how the play areas for children are in US and Canada and any of the developed nations. You can see there are rubber balls, or these are the wood chips which are placed so that children don't get hurt while they are playing. So I hope now it is clear to you that population model of prevention is downstream, that is individual oriented treatments, midstream intervention aimed at worksite organization, healthcare settings and entire communities, whereas the upstream would be at macro level programs and healthy public policies. So what is better? Avoid smoking and drinking or treat cancer? Is this doable? Yes, of course. You can do away with this. Is this doable? Yes. If somebody gets cancer, of course, we do surgery. But I would ask, what is better? Avoiding smoking and drinking or treat the cancer after it has happened? All of you would agree that the first option was a much better and a much safer option. This is how a pack of cigarette would look in the 1970s and 80s. Beautiful, well-defined features, and then it was found that tobacco is the main source of oral cancer, right? Lung cancer, and this is what has happened. Ministry of Health and Family Welfare in 2020 amendment has made it mandatory to have these pictures, which should cover 75% of the packaging on the cigarettes, any tobacco related product, and the pixel has to be very clear so that pictures are absolutely visible. Now, PhD is at an intersection of oral health and public health, presently at crossroads, and it needs for intersection. Public health matters, so does oral health. Custodian of patient oral health, integration of oral disease in non-communicable diseases surveillance. Public health dentistry is the face of dentistry. Ample literature is available on the alliance between periodontal infection with CVD, diabetes mellitus, preterm, low birth weight pregnancy, GERD, heart disease, stroke, osteoporosis, rheumatoid arthritis. So, periodontal disease is associated with so many diseases, correct? Extensive literature from developed countries was reported vis-a-vis association of oral disease with non-communicable diseases such as diabetes, cardiovascular disease, chronic respiratory disease, osteoporosis, chronic renal failure. Commonality of risk factors, changes in systemic inflammatory mediators and body metabolism have been shown to play an important role in this association. Now I was telling you how it affects. I told you in my future slides, I will tell you cardiovascular disease. If you see, gum disease is one of the risk factors for heart disease. And between 80 to 90% of heart disease can be prevented with lifestyle changes, right? Similarly, diabetes, 95% of the people with diabetes also have periodontal disease. People with periodontal disease have more difficulty controlling their blood sugar levels, so they are interrelated. And if you see, the cost factor is shown on the right side. Treating gum disease lowers annual medical cost associated with diabetes by 32,840 per year for diabetic patient, each patient. That is 39.4% per year with diabetes hospital admissions. Prevalence of diabetes and diabetes related healthcare costs are projected to double in the next 25 years. Periodontal treatment can improve glycemic control in patients with diabetes. Oral biofilm. If you see, nearly half of the American adults have periodontitis, the most severe form of periodontal disease. And oral inflammation caused by pathogen induces systemic increase in inflammatory markers, which are associated with so many diseases such as heart attack, colorectal cancer, Alzheimer's disease, diabetes, respiratory disease, adverse pregnancy outcomes. To date, global NCD, that is non-communicable disease response, has focused on the 4 major NCDs, that is cardiovascular disease, cancer, diabetes, and chronic respiratory disease. However, there is a range of other conditions, including oral diseases, that are linked to the 4 most prominent NCDs. In fact, oral disease are amongst the most common and preventable NCD worldwide, and they are generally related to same risk factors associated with over 100 non-communicable diseases. So criteria for developing oral health strategies based upon WHO guidance, they are empowering, that is empowering the people, Participatory oral health professionals should encourage the active involvement of key stakeholders in the planning, implementation, evaluation of oral health strategies. Holistic oral health initiatives should foster physical, mental, and social health and focus upon common risk factors and conditions that influence both general and oral health. Intersectoral oral health professionals should collaborate with the relevant agencies and the sectors to place oral health upon a wider agenda for change. Then equity oral health policy should be guided by concern for equity and social justice and should ensure that inequalities in oral health are addressed where possible. It should be evidence-based, sustainable, multi-strategy evaluation. Sufficient resource and appropriate methods should be directed towards the evaluation and monitoring of oral health strategies. Both process and outcome evaluation measures should be used. Interstate equality among public health dentists in India. There are a total of 5014 positions available for entering postgraduate training in dentistry in India in all the 9 branches. This is data is from 2014-15. Out of this, only 185 positions are available for postgraduate course in public health dentistry. This is the distribution of dental colleges in state-wise and number of available public health dentists in those states. You can definitely see the difference of state-wise colleges and state-wise availability of number of public health dentists in those states. Lot of discrepancy. So coming to dental public health dentistry as a comprehensive branch. Now, what is a comprehensive branch? This is the factor which is going to change your thinking about dental public health. Critical thinking skills during the comprehensive care of all patients regardless of age. Preventive dentistry services to improve overall and oral health of all patients regardless of age. Quality dental care to diverse population of patients in a multicultural work setting. Demonstrating professional behaviors consistent with the legal and ethical expectations of the profession and the public. Formulating treatment plans with emphasis on the collation of all pertinent facts and provisions of choices for alternative treatment plans. Utilizing the principles of operative dentistry to remove defective tooth structure and restore teeth to acceptable form, function, and aesthetics. Selecting and using the appropriate dental materials to restore prepared tooth structures through evidence-based literature. Basic principles of fixed and removable prosthodontics. Understand referring to specialists when indicated. Applying business and economic concept to dental practice management decisions. Reviewing patient medical information and knowing the proper referral for hospital-based care. Comprehensive dentistry, a dental public health profession, is allowed to perform all phases of dentistry on a postgraduate level as well. Phases include but are not limited to crown and bridges, implant supported prostheses, root canal therapy, partial and full dentures, porcelain onlays, porcelain inlays, laminates. In addition, a preclinical practice component which occurs simultaneously with applied clinical portions. Now my question to you is it, when I asked you clinical versus non-clinical, so what do you say that? Any person who is doing all this, can the branch be a non-clinical branch? No, I don't agree with you. So what has to be done? It's rebooting dental care delivery system in India, which needs governmental support, linkage of PSC, CSC with dental units, extensive dentistry on wheel covering, geographical areas, use of information technology based dental service delivery system. Understanding the scope of dental public health from all-in-one dentistry to one-in-all dentistry, preventive, promotive, curative, and rehabilitative aspects encompassing various fields and specialties, where we stand at what we exactly do. Future workforce, oral health promotion workforce includes community health workers, community-based oral health promotion specialists, community-based DPH, clinical dentist and hygienist. Advanced dental public health specialists include epidemiology, health management and policy, strategic planning and social marketing, program development and implementation, policy and advocacy, evaluation, economics, health promotion, but with a certificate in dental public health sciences. Now let me play an interesting video for you. What you are seeing is people are disappearing probably into the river, because it seems that they are going under the bridge and then they are disappearing. But what exactly it is this has been shot from the roof of a building, and this is the edge of the building from where it has been shot. So it's actually the angle which makes the difference. What do you see here? On the first look, you would say that there's a person who's riding at the back of this lady. No, it's not so. Again, you're viewing from a different angle. If you see clearly, there's another bike here, and the person is riding on a tall bike, but is not riding at the back of this lady. Another example. Now this person can have a look at the whole of this model, but why is he just painting the hat of the lady? Anyone? It is just because of the angle from where you are seeing it. If your angle is not correct, you're not going to see the thing correctly. So how dental graduates see PhD? They feel that it is just a survey, indices, fluorides, pit and fissure sealants, whereas it includes preventive dentistry, geriatric dentistry, special care dentistry, comprehensive dentistry, which includes fillings, root canals, scaling, dentures, etc., research, planning and evaluation, biostatistics, tobacco counseling, school dental health programs, mobile dental units, epidemiology and prevention, not limited to cancer, but dental caries, periodontal disease, dental trauma, TMJ, MPDS. So if somebody is being trained for all these activities, just imagine the scope one has to excel. You can go and fly and do anything in any one of the specialties. So much is there in this specialty which no other specialty can tell you. So if you don't build your dream, someone will hire you to help them build theirs. Together we can, because dentistry is by the people, for the people, of the people. Challenges are the opportunities. The policy of being too cautious is the greatest risk of all. Anybody has anything to ask? This is my email ID. You are more than welcome to mail me or text me. I'll be more than happy to guide you or suggest you, or whatever best I can do for you. I'm there to help you. Thank you so much, all of you, for a patient hearing. Thank you so much, Dr. Denzy, for giving me an opportunity to address the people from India and abroad. Thank you so much once again.
Thank you, sir. Thank you so much. I think that was a splendid presentation, not just in terms of the content, but I think the various aspects of the specialty which you put forward, sir. Just adding a bit to what you said, as you mentioned rightly, I think public health dentistry, more than being well understood, is the most misunderstood branch in dentistry. So I think that actually was really helpful and insight. Okay, so I think we'll take in some comments from faculty. Good evening. We have Hiramat sir along with us. Hiramat sir, good evening. Happy Teachers Day. Congratulations on the award given to you by the university today, sir. Can we have Hiramat sir address the gathering, please? So kindly unmute yourself and speak, sir. We can see you, sir. Hiramat sir. Meanwhile, we would like all the participants to fill up the feedback form. I've posted the link in the chat box. Please give us your feedback, give us your queries and comments as well. We will get back to you all. Yes, Hiramat sir, can you hear us?
Sir, you have to unmute your mic, sir. We can't hear you.
Yeah,
There's an option. There's an option below the left side corner of your laptop. Please unmute your.
Let me do it, sir. Yeah. Yes, sir. We also have Dr. Vamshi Reddy sir along with us here. Yes, Dr. Hiramat sir.
Yes, sir. Can you hear me now?
Yes, sir. Finally, great. So great to hear you, sir. Please, sir. Please.
Good evening, everybody, and wishing very happy Teachers Day to all of you. And it was a very nice presentation from Dr. Marya. It was very useful for, I'm sure that everybody enjoyed it. Thank you so much.
Thank you, sir. Thank you for.
Can you hear me, Dr. Denzy?
Yes, sir. Yes, sir. Everybody can hear you. Yes, sir. Please continue, sir.
Thank you. Thank you so much.
Thank you, sir. Thank you, sir. Yes. Dr. Vamshi, sir, can we have you just say hello to everyone?
Good evening, everyone. Dr. Charu sir, Hiramat sir, and all the senior faculty and all my teachers, a very happy Teachers' Day to one and all. And it's not only from teachers, and a very big hi to all the undergraduates and postgraduates. And there are a few of my postgraduates as well, whom even I have learned certain things in my due course of journey as a teacher. Wish you all the best. Dr. Marya sir, it was very enlightening and refreshing to go through your slides, sir. Thank you very much.
Thank you, sir. Thank you. So we're requesting all the students to please fill up the feedback forms. We have a section on the queries. So if you have any specific queries related to what opportunities are opened up and what could be done after developing an interest in a certain sub-branch of the specialty, so you can always do right, send in to us. Yes, sir. Any closing remarks? Back to you, Marya, sir. Yes, sir.
Am I audible?
Yes, you're audible, sir. Please go, sir.
Thank you so much, Dr. Hiramat sir. It was very encouraging words from your end, and congratulations for a well-deserved appreciation by the government to you, sir. And thank you so much, Dr. Denzy, for allowing me to speak. And my friend, Dr. Vamsi, thank you so much for appreciating. I am looking forward to yours presentation and Dr. Chandrasekhar presentation. I hope the students are going to learn and know more and more about our specialty, probably it is our responsibility to tell them what exactly our specialty is. Thank you so much, Dr. Denzy.
Okay, thank you, sir. Thank you so much. Please do continue with us. Yes,
Marya,
Dr. Anand.
thank you.
Thank you each one of you.
Yes, Dr. Anand.
Hello, sir.
Okay, all right.
Thank you so much, Anand. And each one of you there. Thank you so much.
So before we move on to the next session, would be an equally engaging and interesting session, which will be taken by Dr. Chandrasekhar Jankiram sir. We have a small surprise for everyone. I think everybody needs a little break from the monotony, right? So after having learned from the challenges and opportunities in dental public health, we would like to take a small break, and we'd just like to share a small music medley, which is a performance by a public health dentistry PGs, that is postgraduates, who have prepared a small musical for all of y'all. So I will be sharing the screen right now, and I request all of you to just go back, enjoy the video, the performance on the guitar and the keyboard, and then quickly we'll be starting with the next session for today, which is by Dr. Chandrasekhar Jankiram sir. Yes, I will. The performance coming up is Dr. Aniruddha and Dr. Protim, who are postgraduates from Department of Public Health Dentistry and Conservative Endodontics. They have been jamming for pretty much time, and they have come up with a small special on Teachers' Day. So they have a medley for all of you here. So I think we can just all go watch the video and come back soon.